If you find this video helpful, don't forget to hit that like button and subscribe. And if you have any questions or need more info, drop your thoughts in the comments. I'm here to help. Today I'm breaking down the urinary system. Yep, the part of your body that filters blood, gets rid of waste, and keeps your fluids and blood pressure in check. When things go wrong here, it can lead to all kinds of health problems. So, let's get into some of the most common urinary system pathologies, what causes them, how they show up, and what you can do about them. Let's start with urinary tract infections, or UTIs. These are super common, especially for women. Most are caused by bacteria like E. coli and can hit your urethra, bladder, or even your kidneys. You might feel a burning when you pee, need to go more often, or notice cloudy or even bloody urine. If it reaches your kidneys, watch for fever, pain in your side, and nausea. Diagnosis is usually a urine test, and antibiotics clear up most cases. You can also help by drinking more water and practicing good hygiene. But if left untreated, these infections can come back or cause kidney damage, so don't ignore those symptoms. Next up, kidney stones. Those tiny but mighty mineral deposits that can cause intense pain. Think dehydration, high-salt diets, or certain metabolic disorders as causes. You'll know something's up if you get severe pain in your back or side, bloody urine, or nausea. Doctors usually use imaging like ultrasounds or CT scans to spot them. For small stones, drinking lots of water and taking pain meds might do the trick. Bigger stones might need procedures like shockwave therapy. Preventing them comes down to hydration and a healthy diet. But beware, stones can block your urinary tract, cause infections, or damage your kidneys. Chronic kidney disease, or CKD, is when your kidneys slowly lose their ability to do their job. Causes include diabetes, high blood pressure, and some genetic conditions. Early on, you might not notice anything, but as it progresses, you could feel tired, swollen, or have high blood pressure. Blood and urine tests help diagnose CKD, and treatment focuses on the underlying cause, like controlling blood sugar or blood pressure. Later stages may require dialysis or even a kidney transplant. CKD can be serious, leading to heart problems or dangerous imbalances in your body. Now let's talk about glomerulonephritis, which is basically inflammation in the tiny filters of your kidneys. This can be triggered by autoimmune diseases or infections. Look out for symptoms like blood in your urine, swelling, or high blood pressure. Diagnosis involves urine and blood tests, and sometimes a kidney biopsy. Treatment depends on the cause and might involve steroids or other medications to calm the immune system. Nephrotic syndrome is another condition where kidney filters get damaged and you lose a lot of protein in your urine, causing swelling and fatigue. Causes range from specific kidney diseases to diabetes. Treatment usually involves medications, diet changes, and sometimes steroids or other immune suppressants. This condition can up your risk for blood clots and infections, so close monitoring is key. Let's switch gears to bladder cancer, a malignant growth in the bladder lining. Smoking and chemical exposure are big risk factors. The most common sign? Blood in your urine, often without pain. Diagnosis involves a camera exam called cystoscopy, imaging, and sometimes a biopsy. Early-stage treatments might include removing the tumor or using medications right in the bladder. Advanced cases could need surgery or chemotherapy. And for the guys, there's benign prostatic hyperplasia, or BPH, which is just a fancy term for an enlarged prostate. It's not cancer, but it can make it tough to pee. You might notice a weak stream or need to go often, especially at night. Diagnosis is straightforward, and treatments range from medications to minor surgery, depending on how much it bothers you. No matter the condition, doctors use a mix of urine tests, blood tests, imaging, and sometimes biopsies to figure out what's going on. The best ways to keep your urinary system healthy: stay hydrated, eat a balanced diet, practice good hygiene, and get regular checkups, especially if you're at risk. Alright, that's a quick but thorough run-through of urinary system diseases. If you found this helpful, smash that like button, subscribe for more health info, and let me know your questions in the comments. Thanks for watching, and take care of those kidneys.